Ahmedabad. Great.
Shambhavi?
Dr. Pawan from Gandhiram, Dr. Ravindra from Bengaluru.
Good evening, everyone. I am Dr. Pragnesh Vacharajani, Secretary FFPAI. It is like a dream come true. When we took over as a new team has took over the Helms of Affairs as FFPAI last year, this was one of the pet and much awaited project. And my wish was to involve family physicians in the clinical research, paper publication and all. Because if you see the landscape across the world, everywhere the health authorities, they consult the family physician first about the guidelines that they wanted to form, the disease treatment plans that they wanted to form. And in COVID, we have proved beyond doubt that we are the pillars of the healthcare, and we family physicians are the most important part of and pillars of the healthcare system of any country. So to have authenticate data, because we family physicians see good number of patients, we all have got large volume of patients, but unfortunately that is not being properly documented. I don't say not documented because nowadays most of the doctors are using electronic data. So we had a long discussion with Dr. Chinmay before that how can we do it, and day is here that we are here today with the first program of the series. I request all of you to please remain actively involved in the program. Dr. Chinmay will explain the things as the time goes. But we have sent repeated WhatsApp and email to the members who have registered. Still, many of you are not there in the dedicated WhatsApp group formed for the purpose. So I request all of you to please join that dedicated WhatsApp group which is formed. You must have received an WhatsApp and email from FFPAI official number. If you are not received, don't worry. You can let us know later after the program and we'll send you the links again. So without much ado, and I welcome you all once again on behalf of Federation of Family Physician Association of India. And I will request our Vice President and Academic Committee Chairman, Dr. Preeti Shankar, to take the proceedings forward. Dr. Preeti, please.
Thank you, Dr. Pragnesh. I once again welcome you all to this much awaited and liked program of ours. This, like Dr. Pragnesh just said, this is the dream project of Dr. Pragnesh, both the Pragnesh duos. So with the chairmanship of Dr. Pragnesh Shah and Dr. Pragnesh Vacharajani, we are growing leaps and bounds, and we have a lot of programs for you ahead. The importance of research in family medicine has just now been enlightened to you all by Dr. Pragnesh. Nothing more to be said about it. We are the first contact for the patients, and so we have the maximum data about the presentation, about the illness, about the treatment, and the response to the treatment. Keeping that in mind, this program is formulated for you all. We have 4 sessions, which is starting today and on the next day of Christmas. It is wonderful that so many of you have still joined in spite of the hospital holiday mood and festivities around you all. Thank you all for joining us. So this program will have 4 sessions, and those who have registered for the program and attend all the 4 sessions will be given a certificate and will be participated totally. Every fortnightly we will have a program. 3 of them will be online. The last program will be in coincidence physical and virtual. So those who do along with the annual conference of Ahmedabad Family Physicians Association, which is to be held in Ahmedabad on February 18th. So the last program will also be virtual. So those who are not attending the conference can definitely join virtually, and we will be giving a certificate to all those who have joined. So this is in brief. It is definitely going to be a beneficial and a very interesting program. Along with all of you, I am very eagerly looking forward to you. I have been part of research in the diabetic field with Dr. Mala Dharmalingam. But still, I would like to learn from the fundamental from Dr. Chinmay. And to introduce Dr. Chinmay briefly, there is no brief. He is wonderful. So he is Dr. Chinmay Jayaprakash Shah, who's done MD Physiology and PhD in Physiology. And he's also completed his postgraduate diploma in HPE from KLE University. And he is founding editor of the National Journal of Integrated Research in Medicine and accessor for NABH Hospital and NABH Ethics Committee. He is a guest faculty on more than 15 online courses, one of which we are attending today. And he is 18 years of teaching experience. Looking forward to hear from you, sir. He has developed his own learning management system. What else? So he has got LMS, which is a course, as well as a biomedical waste management disposal learning assessment and Android application. He has 26 awards to his credit. I think we will be giving you the 27, sir. So 26 awards to his, including the IMA Honorary Professor Award in 2021 for contribution in medical education on 5th September 2021 and IMA Medical Achievers Award for 2014. To say the least about him, he is a subject expert for physiology, National Board of Examination, as well as National Medical Commission, New Delhi. He is a member of the Central Task Force for updating NEET exams, MCQ exam. And who else could we expect? What more could we expect? We are hearing from him today. Welcome you, sir. Grand welcome to you. And we look forward to all the 4 sessions which we start today. Any doubts you have, you can put it in the chat box. And those who have not put up your name and the city in the chat box, please type your names and your city from where you are in the chat box. Over to you, sir, Dr. Chinmay Shah, for you all.
Thank you very much, Preeti ma'am and Dr. Pragnesh sir, for a warm welcome. And I must congratulate to take this lead, because I can see that the family physicians are working day and night. They are working like 24/7 in real means. And I must congratulate those all who are here, because up to 9 o'clock you may be in the clinic, or maybe by 8:30 you are in the clinic, you have finished your lunch or dinner, or maybe pending it, and you are a part of this wonderful CME. So I must congratulate. So those who have joined and has joined the link of today's, it itself says that you are passionate about the research. So thank you very much for joining here and putting trust in me. Would like to share my screen. Okay. Can you see my screen?
Yes, sir.
Yes, sir.
Yeah. So only few announcement or few suggestions or request we can say, that I request all of you to please your mic muted. If you have any question, please put it on the chat box, or at the end we will have a one-on-one session where you can raise your hand and you can ask your question. So as Preeti ma'am has already said, that we are going to discuss regarding different 4 sessions. So the first session today, what we are going to discuss is steps of conducting research. The second sessions will be different types of publications. And keeping in mind your busy schedule, but an important case coming to you, we are going to focus on one type of publication, that is case report, in third session. And in fourth, we are planning to have a presentation by few of you in a group. Okay, so this is in nutshell how we are going to proceed. So thank you very much, FFPAI. And you are looking at one of the word, which is PRIME. The full form of PRIME is Promoting Research and Innovation in Medical Education. This is an initiative of Government of Gujarat, Director of Medical Education. Because along with the medical education, we need to also target research. Okay, so let's start. Yes, are you ready? You can just put yes in the chat box. Are you ready? You can put yes in a chat box or simply Y in a chat box. Yes, great. Yes. So your enthusiasm gives more inspiration to me as well as the organizer. So this is the outline of my today's sessions. That what is research, how to choose a research topic, attributes of good research, steps in conducting research, and common errors in dissertations. Or now here you can see that common errors you can found in a literature. Okay. So as I had already put in the our WhatsApp group, so those who are there, I have asked three questions. Question one was how many of you have conducted research. Question two was how many of you have published research, and third question was how many of you are reading literature for updating the knowledge. And I think all of you must be getting medical representative day in and day out to your clinic, and they are, what are their degree? Either they are BA, either they are BSc or BCom, and they all are teaching us that this drug is better and this drug is not better. Okay, so one of the side product or side advantage of this four session will be you will be able to now properly recognize that who is telling good and who is, or we can say who is telling truth and who is telling lie. Okay, because it is all game of publicity. Okay, so let's start. So can anyone tell or put in the chat box, why do we do research? What is the reason of research? ये क्यों करना चाहिए? What is the need of research? You can put in the chat box. Okay, so let me tell you, excitement of making discovery sometime, और हमें कुछ चाहिए, कुछ खोजना है, because you all are getting day in and day out lot many patients, so sometime जो अपने अंदर का कीड़ा होता है वो कई बार बाहर आ जाता है कि चलो देखते हैं ये क्यों हो रहा है. फॉर एग्जाम्पल इन कोविड इसको करते हैं, चलो ऐसा भी ट्राई कर लेते हैं. तो परस्यूट ऑफ नॉलेज ड्रिवन बाय पैशन, बिकॉज कई लोग ऐसे हो जिसको कुछ ना कुछ ढूंढना रहता है. इन सर्च ऑफ रिकॉग्निशन एंड प्रेस्टीज, बिकॉज इफ यू पब्लिश्ड पेपर your name will be there in the journal, and if the same publication is there in the newspaper, it will be there with the your name. And if you are there in any of the institutions where you have attached the department, you are a medical officer at few of the department, you are going to do it because your HOD or dean wants that. Okay, हर एक department से इतने publication आने चाहिए. So these are few of the reasons why we want to do the research. Okay, so the next part is, if you look at this circle, okay, this is a basic circle which is needed or which gives a birth to any of the research. Okay, so as this is circle, we can start from identify the knowledge gap. For example, you have seen that this drug is working in COVID and this drug is not working in the COVID. So what we will do, we will identify the knowledge gap. कितना भी गूगल कर लिया, कितने लोगों को पूछ लिया, अपने को पता नहीं चल रहा है कि मिथिलेन ब्लू is working or not. Okay, or any other red or white drugs working or not. Okay, so once we have that knowledge gap, we will search everywhere. And here we have written one word, it is a systematic search for an adequate answer. Okay, फिर भी अपने को नहीं मिला, then we will have one question in our mind. Okay, it will come to our mind that yaar, now I have one question, that what is the effect of sleeping late or using the social media on my practice. Okay, and then we will clarify that question more detail कि कौन सा social media, कौन से time पे, why, when, there are a lot many questions, and then we will design the study. Let's do the study, because as one of our participants has mentioned in the chat box that we want to do the research to get an evidence-based fact. Okay, same way one more sir has mentioned, need of a research is to know the statistics, side effect, and know the reality. Yes, So we will design the study, then we will collect the data, we will analyze it, and then based on the analysis and result, we will try to implement. Okay, 2 घंटे ऐसे करने से क्या होता है, या 3 घंटे ये दवाई बढ़ाने से क्या होता है. Again, the circle will continue. Somebody may again have a knowledge gap identification, and then the circle will continue. Okay. So what is actually research? What is actually research? Anybody wants to define what is research? Yeah, surely, sir. I will try to use English only. Thank you very much for drawing the attention. Anybody want to define research? Yes, anyone? You can raise the hand so I can unmute you. Or you can write in the chat box. Okay, let me answer. So in a simple word, it is a careful investigation or inquiry, especially through search for new facts in any branch of knowledge. So this is a simple definition. If you want to elaborate more, it is a systematic, FSR नहीं है, ठीक है, rigorous investigation of a situation. So not always a disease, of a situation or a problem in order to generate new knowledge. So there are two purposes: generate new knowledge or validate existing knowledge. Our seniors were telling this drug is useful. Now I want to check is really useful today or not. Okay, or I want to generate the new knowledge that I am using ampicillin, cloxacillin in this drug. Is it useful in this disease or not? Okay. So now I am giving you 1 minute. On your pen and paper which you have, you can write 2 to 3 research topic which comes to your mind. Okay. So let's take 30 seconds to 1 minute and think. Use your pen and paper. And write down. Or if you have a mobile, you can just open the notes section of your mobile and write down 2 or 3 research topic you want to do. अगर आपको बोला जाता है कि कल से आप, if it is allowed to you that start doing research from tomorrow, which topics you want to do, or just note down that this is the topic I want to do the research. So we have few topics coming up: remissions of diabetes mellitus, prevalence of self-medication induced adverse effect in general practice, cure of cancer. Okay, good. Borderline hypertension to control without medicine, usefulness of HbA1c. Yes, excellent. See why that the thought came to Dr. Pragnesh, why that, as he said, that you are the person of first contact. Okay, so if you start involving in the research, we will have a real data. See, most of the time, if you look at the investigation and whatever range are coming, for example, range for normal range for vitamin B12, normal range for HbA1c, everything are coming from outside India because we don't have our own data. So if you all are involved, we will have a repository of normal data and we can then have our own stand, our own Atmanirbhar India or Atmanirbhar Indian health system. Great. So we have a prevalence of acne in Indian population and set repeat endorsement, how to prevent pandemics. Great, great, sir. So let's move forward. So keep this topic in your pen and paper or in your mind. And as we go further, we will try to define your questions. Okay. So how you will choose the topic? Okay. How you will choose the topic? That is first question. So number one is what is your area of interest? Okay. So what all you have mentioned is your area of interest. Am I right? Okay. Second, review of literature, because many of us has an habit of reading a literature, and you go through the literature and you come to another, okay, we don't have an answer to this question. Okay. So in that case, you will do the research of based on the literature review. Okay. Third is reading an article. You just came across one article that taking lady finger will reduce your weight in a 2 days. I'm just bluffing. Okay, I'm just giving an example that you come across this article and down you think that, yeah, who has written this? Because when we are not putting our own words, see, I have seen that the real correct people are not putting their pen down. Incorrect people or those who are having a half knowledge start putting their knowledge in the system, and it against come to the resistance with us. Okay, so after reading an article, attending conference, CME, okay, because if you went to conference and you come to know that, okay, this is the something which I want to learn, okay, then you are attending a CME. So based on the CME, you will find out that, okay, this is the topic of my research. Then review meetings. For example, you are a part of IMA or FPA and you are attending a maternal death reviews at corporation or city place. You come to the, let's me do the research. And again, as I said, that if you are in the any of the medical colleges or you are doing under some of the guidance, so you will look at the previous thesis or dissertation, or if you are interested, even if you are a medical officer or if you are a family physician, you can visit the library and see that is any thesis or dissertation has my answer or not. If not, then go ahead and do the research. And lastly, if you are doing any under anyone, as per the peers and your guide. Okay. So there are many places where they have started mentoring for a research. So that also I think can be a next step, for mentoring for doing a research by family physician. Okay. Is it clear? If you have any question, please put in the chat box if you have any questions. Great. We have a few more topics in the chat box. Okay. So this is actually basic steps of any research. Okay. Any research. So first is brainstorm the idea. Whatever thought coming to your mind, start thinking on the topic. Talk to your friends or a professor friends. Okay, that is it a good or not? Is it worth doing or not? Because if you talk to your seniors, some of your friends, you will come to know that, okay, somebody's already worked on it and he has not succeeded or he has succeeded negatively. Okay, then you go to the internet and ask Google Baba, ask PubMed, ask Google Scholar regarding the topic. Okay, and whatever data you have gathered, sleep over it, means put it under your bed or put it in your cupboard for 24, 48, 36 hours. Because in this time, you will have some more idea. You will have some more clarity. Okay. And if you're working with any mentor, you can ask your mentor also that, is it okay or not? Okay. Then if he or she say yes, or if you are doing alone, if your friends, and ultimately you are coming to the conclusion that it can be done, start working on it. The next is outline the idea and project expectation and goal. That, okay, I want to do and I want to reach up to this level. Now we will go into the detail that how to do it. Then we will do the research. Once you start doing research, you will have some data, you will have some literature, and then you have to start writing on it. Keep it, as I have said, sleep over it, keep it for some time. You have some new idea, you have some thought, and then connect with your peers, connect with your seniors, connect with your mentor, and then start doing this to 10 and 11 until and unless you will finish writing your research. Okay, clear? So this is a cycle of any research. I know we all are MBBS and beyond it, and so we all know, but this is just to refresh what we can do and how we have to do. Now let's look at the attributes of good research. What you can say is a good research. Okay, so it must be planned, not haphazard. Okay, clearly defined. Now I am just randomly picking one or two example. For example, one of the question is how to prevent pandemic. Now, as I said, that clearly defines. So when we put any word, it is not going to give any clarity to the person who is going to read. So we need to clearly define it. We will see how to define it. Okay. The next is specific. Okay. So I am just taking one example to explain. It is nothing like specific to any person. I am just keeping that as an example. So specific in adult, in pediatric population, in housewife, in pregnant woman, in elderly, in rickshaw driver. Okay, you have to be specific. Focused, because if you try to gather everything, it will not be possible. See, treatment is separate and research is separate. Please keep in your mind that when you are doing research, it is a separate from when you are doing a treatment. Okay. Then replicable. Once you do it and somebody asks that, okay, I also want to do, you should be able to explain him or her how you have done, and it is a replicable. Okay. And conclusive. You must be knowing that it had some conclusion, either positive or negative. See, there are now journals publishing only negative result. Means what you said is not proved. Okay. Okay. Can anybody tell me the meaning of this last bracket? It's fine if not significant. Can anybody tell me? Please raise your hand or write in the chat box. What is the meaning of last bracket? It's fine if it's not significant. Anyone? Yes, Preeti ma'am.
And sometimes the results are not conclusive. They can be insignificant, and that is permitted, or I mean, it's part of research. We come to know that it is not very useful.
Yes, ma'am. So if you look at the journals and the articles, there is something known as less than P, P more than 0.005. So when this P word is used and it is more than 0.005, it says that it is not significant. Now, let me take few seconds to explain what is P. It is a probability when it become, see, when we, for an example, take 100 sample, and out of 100 sample, if more than 5 samples are not agreeing with what you said, it means that rest result may be by chance. So it should be less than 5%. Okay. And then it is considered as a significant. But even if it is not significant, it is conclusive. Okay. This is the difference between these two drugs. Though it is a not statistically significant, but difference is there or difference is not there. Okay. Clear? Now, if you look at the below table, these were the attributes. Now, what are the required? Something will be common in attribute as well as requisite. Number one is a focus, area of your interest or expertise. For example, you are getting maximum patient of acne, or you are getting maximum patient of knee joint. So you must work on that. Okay, because it will help in the meaningful progress. Then rational, clinically relevant. You must have some proof of concept, and you can have a challenge, or you might be thinking that I can change the current treatment methods. Okay, it should be valid. Here we will look at the validity afterwards. Then feasible. Okay, it should be feasible according to the time, according to the study population, infrastructure and skill. I want to do genotyping, but I don't have a facility. How can you do it? And the important part, ethics. Okay, we must follow the ethics. And last, the budget, money, whatever material, manpower and equipment you have, we have to follow that research. And so, as you all are busy, keeping in your mind two part, feasibility and budget, we have chosen to start with the case report. Okay. Yes, Bimal sir, you had raised your hand. You want to say anything?
No, that was mistake. Thank
Okay,
you.
thank you. Yeah. So again, one more word came, characteristic. It should be interesting. If you are doing something interesting, you will enjoy it and you will finish it uh, for sure. If you are doing it without interest, you are not going to put your 100% in it. Okay. Significant, as you know that whatever you are going to contribute. See what is happening, that our big scientists are sitting in the big lab, they are doing a breakthrough research, but sometimes some research are so expensive that it is not reaching to the common man. Okay, so what I request, that when you are taking an initiative, do a simple research. For example, malaria, you do something in malaria, you do something in diabetes. A simple thing will help lots and lots of people. Okay, manageable. Okay, start with the research which you can manage in your clinic. Okay, as I said, it must be ethical. Use of jargon and fancy statistics are not necessary hallmark of good research. As we see in few of the movies, they use very difficult word to describe the disease. It is not needed. Why? Do simple. As I said, that big research are not always good, and small research are enough for attending one to through objective writing on paper. So now what I request all of you, that you all have a thought that I want to do research in this topic. Now here we have used one word, objective. So there are two things. One is aim, and what is my aim? And second is objective. So now I am giving you 30 more seconds to 1 minute. You think on your topic. So first of all, start or uh, try using these things, whatever you're thinking or whatever you thought of, start the same line, same topic again, keeping in mind this. Okay. And then write one aim and one objective. Now, what is the difference between aim and objective? Aim is that I want to do a study of X drug for Y disease. Okay. In pediatric age group of Ahmedabad. So now what are your objective? What are your step by step? You will enroll the patient, then you will give the drug, you will see the difference. So steps will help you to achieve the aim are known as objective. So I'm giving you 30 seconds to 1 minute. Think on it and write down on paper which you have written your title. Okay. So I request everybody to please write it down. So let me keep things here very easy. So how far is reversal of diabetes successful? Now here you have to also define diabetes type 1, type 2 in male, in female, both the age group, controlled diabetes or uncontrolled diabetes. See, try to see all these 1, 2, 3, 4, 5, 6 things. How many of you have finished? Okay, we can see a few of the response in message also. Pragnesh bhai, will it be possible to do breakout room? Diarrhea infective versus others. Okay. So safe treatment for acne, the objective is to develop treatment regimen. Okay. Spectrum of clinical manifestation and treatment modalities in Gen 1 variant among 18 years to 80 years of age group over 1 month. Excellent, ma'am. Yes. Everybody has finished? Okay. So should we continue?
Yes, sir.
Yes, sir.
Okay, great. So thank you very much, everyone, for putting your word into the chat box and those who have said on the piece of pen and paper. Okay, so this you have seen that now you see that whatever you have given thought based on these you have elaborated. So now you are a little bit more specific, a little bit more focus. Okay, so actually what we are going to learn in 1 hour, it is actually a workshop of more than 3 hours. But we are going to learn fast because you all are more mature than the students and we don't have much time also. So rest we'll do as a homework. Okay. Now, from where we will get idea? These are the places from where we can get an idea. First is burden of illness. For example, you are getting 50% cases or more than 50% cases of diabetes or acne or knee pain. Okay. Then second is etiology of causation. You are not able to know that why the diarrhea is more in this area. Okay. Third, the same diarrhea are heavy or more patients are there. You will see that let me do something that it is effectively helping a community. Then sometimes you see that ORS is not working properly in the diarrhea. So what changes I can make in the ORS so it will help the efficiency of ORS will increase. Okay. Now, if you go to the 5th and 6th step, it is like, for example, we have a Mahayodhana, we have a PMJY. So you gather the information of that and actually come to know that, okay, is it really effective or not? Usually government do the 5th and 6th type of research to know that whatever they are spending is correct or not. And 7th is reassessment. That patients are coming to you every 15 days, 1 month, 3 days, 4 days. So based on that, you will come to know that, okay, there is some problem somewhere and we need to find out the problem. Okay. So this is the point till which what we have discussed is how to get an idea of research and what are the characteristics of research. Any questions so far? Any questions so far? Okay. So, yeah. Yes, ma'am.
Sir, is it ethical to take help from the institute where we are working or consulting?
Yes, definitely.
Okay.
Thank you. So let's go to the next part of the presentation. That is steps in conducting a research. Okay. So what are the steps? Number 1, formulate a research question. Okay, Sanjay sir, please remind me your question at the end. We will discuss on it, how to select a mentor. Formulate a research question. That is step 1. Step 2, extensive and thorough literature search. Step 3, framing research hypothesis. Okay, we will see in the detail of each step. 4th, select appropriate study design. Now, keep all this point in your mind, even if you conduct research or not, when you look at the literature given by your MR, sir, so they will put some word, which type of study they have done. So if you are aware, you can catch hold of it, that this is not proper study design. So whatever you are demonstrating me is wrong. Develop your study protocol, like a sample size, study questionnaire, consent form, Gantt chart. Then submission to Institutional Ethics Committee or CTRI. See, if you are working in the institution, it will be very easy to go to the Institutional Ethics Committee and apply to CTRI. But if you are working standalone, it is little difficult. And that's why, as I said, it is little cumbersome until you are passionate to go to Ethics Committee and get it approved. And that's why we have chosen, as I said again also, case report to start with. The next is data collection and data entry. 8th is data analysis. 9th is report write-up. Okay. And 10th is dissemination of finding. Okay. This is way how we will conduct any of the research. Okay. So let's start with the first. Formulate research question. Okay. So there is something known as research topic or problem. So what you all have listed is a research topic or problem. The research question is little different. It is little different. For example, it followed the aims and objective. Okay. So let's see. The research problem is comparison between stapler and hand-sewn anastomosis in elective GI surgeries. So this was the research topic or problem, comparison between these two type of method for elective GI surgeries. Okay. So what will be the research question? The research question can be these two. What is the difference in operative time for stapler versus hand-sewn intestinal anastomosis? Second question, what is the difference in the duration of post-operative hospital stay for stapler versus hand-sewn intestinal anastomosis? So this is the topic, this is the research question. Now if you go to the aim is to compare between first method versus second method in elective GI surgery. And what are the objective? Two objective, to compare the duration of operation, and second is to compare the post-operative hospital stay. So these are the parts of comparison. What you want to compare? Here we are in the compare. So in objective we are writing that what we want to compare. Okay. Clear? Any questions in this? Okay. So now we are looking at the types of research question. Okay. Once this is clear, we will go to the types of research question. Okay. So number 1 is descriptive. See, this is most easiest. Okay. Second, inferential or analytical. Inferential or analytical. Okay. So first we are looking at descriptive. So what are the different descriptive? Number 1, it describes the distribution of study variable in population of interest. Variable means which is varies in a population of interest. For example, I am taking an example of Ahmedabad, or let's take an example of Varacha in Surat. You are working in Varacha and you just noting down, if you are using electronic health record, you have a detail of last 1 month. Okay. So your study is to find out the different proportion of different disorders in a patient attending your clinic. Okay. All the patients. So it is little bigger. So what you will do, you will take your data and you will describe the distribution of study variable. For example, variable means age. What are the age group of your patient? What is the area of from where they are coming? What is the sex or gender of the people? What system most commonly affected? What are the different disorders commonly affected? What are the common belief they are knowing? So if you do simple description of what ever study variable in population of interest are there, it is known as descriptive study. Clear? Simple example. What proportion of medical students smokes? Okay. What proportion of medical students have clinical depression? What are the complications following rotavirus vaccine in children under 5 years of age? See, again, I am repeating the word. You are the factory of data. Until now, people have not tried it. And I again congratulating the team for having a vision of starting this series and involving all of you in this series. Okay. So if you look at the population coming to you, you can say definitely that this is good, this is not good. Right now, what is happening? Who is asking us? हमको कौन पूछता है? Okay. So second type of research is analytical. So tries to find out relation between two variables, between two changing things. For example, effect of maternal nutritional status on the birth rate of children. Simple. Okay. Second is make comparison between two groups. What is the efficacy of fistulotomy on outcome of treatment of simple anal fistula compared to fistulectomy? This is fistulotomy versus fistulectomy. Okay. So is it clear? Either is relations in between two variable or comparison between two variable. Okay. So for this, actually for this comparison, the approach used, which is known as PICO approach. Okay. So when you want to write the research question, you have to keep in mind PICO. So what is this PICO? So P is what is study population, which main interventions are considered. I, C means comparison, and lastly O means outcome. Okay. So this is PICO approach. Let's take an example. Okay. For example, what is the efficacy of fistulotomy on outcome of treatment of simple anal fistula compared to fistulectomy? So what things will come? The population is patient with simple anal fistula. See, this you have to keep in mind. For example, I want to do study in dengue in children. So all children are not your population. Your population is patients affected with the dengue. So here patients with simple anal fistula. Routinely क्या कर रहे थे? Routinely what we are doing intervention is fistulotomy. Okay, and what we want to compare is fistulectomy, and the outcome is post-operative pain and wound healing. We will see the difference in this based on these two things. Okay, so this is a PICO approach. So right now we are not going to do the group work for the sake of time, but I request everyone. So next time we will discuss for first 10 minutes. So whatever research question you have written right now, try to develop based on PICO. If you want to take a snapshot, you just write down PICO. Okay. So whatever question you have written, you can then share it in the WhatsApp group also, so we can discuss on it. Okay. So again, we are just repeating the final criteria for good research question. It should be feasible, it should be interesting, it should be novel, it should be ethical, and it should be relevant. Okay. So as we have already discussed, I am not going into the detail. So what are the common issue with the research question? Your question is very vague. You don't know ultimately what will happen. So you have to put it in paper, draft 1, 2, 3, show somebody. Please look at it. Have a look at it. Okay. And then try to do it piloting with 2-3 patients. You will come to know that whatever you are thinking is possible or not. Okay. So as I said, we are not going to do the research question. We will share your homework in a WhatsApp group. Okay. And I think Pragnesh will divide them in different group. Based on that, we will have a group work. Okay. Now, second thing is literature search and review of literature. These are two different things. Let's keep in mind that I want to do some research on COVID-19 in pediatric age group. So I will go in Google and will search. Okay. Let me try to show here only. So how many of you are aware of Google Scholar? Just put yes in the chat box. If you know what is Google Scholar, put it in the chat box. Yes. Or say no. I will be waiting for your answers in the chat box. Either you will put yes, means Y, or N. Can we have a quick response from all of you? Y or N? Okay. Great. See, your response confirms that you all are listening. Okay, because video are off of every one of you. So I also get something feedback from your side that you all are listening and you are with me. Okay, so let me give you a simple example. Okay, so I am putting here one question in the chat box. COVID-19, let's put management of COVID-19 in pregnancy. Let's put this word in pregnancy. So can you see how many things are coming? It's full of lots of pages. Okay, you will keep scrolling, and you don't know who has written what. You don't know, you don't have any confirmation that what is written by whom. Okay, so now let's do the search in the Google Scholar. So Google Scholar is actually a database where you can find a specific article-based response. It is not like anybody will be writing in the blog and it will come. It is a specifically based on a research published in any of the journal. Okay, so let's do search here. So can you see here PDF and nis.gov? So these all are little bit authentic. And the second advantage is here you can see that from which time you want. For example, I want only, see, look at here. It is 9,73,000 article. If I will put since 2013, sorry, 23, it has reduced to 70,100. Okay. Now I want only of 2019, 19 to 2020. $18,000. Okay. Same way you can do it. Now let me copy this, Control X, and we have something known as PubMed. You all are aware of it. And let me put it in PubMed. How many articles are there? 1995. Actually, the PubMed doesn't realize this off and in. So there is something known as Boolean operator. So I will put capital A and D. And I will combine this 19. Just look at the number. Right now it is 1995. Okay. And now I will put A and D. So I want an article which has a management, COVID-19 and pregnancy. We'll click on the search button. You see it has reduced a little bit. So it is now 1956. Let me add A and D India. Only 146 articles. So now it is easy for you to go through these articles if you want to know the details. Okay. So this is a simple things how to do the literature search before you want to start the study. Okay. So literature search. Why we want to do the literature search? Because you want to know that what is done by somebody else before. You want to know that if somebody has done it, how he has done, how he has succeeded or how he has failed. Okay. It will also help you to find out the study design, and that's why literature search is required. Okay. Now these are some of the offline and online resources for literature review. Okay. Now let's go to the next part. If we divide information, it can be data available from WHO, ICMR, sensor information. And if you want to go for journal article, there's something on a systemic review. For that, we have to reach the concurrent library. And for clinical queries, there are certain websites like UpToDate and Clinical Key and lot many. Now, research hypothesis. Previously, we had framed research question. Now we want to write research hypothesis. Now, what is the difference? Let's see. Question will come in our mind. That research question is, what is the difference in cure rate of obesity treated with modern medicines versus Ayurvedic medicines? So what will be the hypothesis? Cure rate of obesity is higher when treated with modern medicine compared to Ayurvedic medicine. Okay. So this is what we are doing, and this is what we want to compare. So this is a research question. This is our hypothesis. Is it clear? Yes? Can we have a Y in the chat box? Yes, great. Thank you. So if we look at the evidence, because ultimately what we want to do everything for evidence. So basic is expert opinion. Start with the expert opinion, then goes to case report and case series, then goes to cohort studies, randomized control trial, critically appraised individual article, then appraised topic, and highest is the systemic review. So we are starting with this second step, and then we will go further. Okay. Now next come select appropriate study design. How you will do the study. Okay. So as we have said, observational or descriptive, and second is analytical or experimental. Okay. So these are some of the observational: case report, case series, cross-sectional, case control, and cohort. Okay. While experimental comes randomized control trial, non-randomized control trial, community trial or field visit. And now one more is started, that is a real world case. Real world case study. Okay. So actually that also comes under observational study. Clear? So we are starting with the basic, that is a case report. So case report is nothing but reporting a single case. Reporting a single case. Okay. Second is case series. So you have one patient of COVID, second patient of COVID, third patient of COVID, and fourth patient of COVID. And so these all are the unique case which is not published anywhere, or it is difficult to find, or you have some unusual presentation in your area. So you combine case 1, 2, 3, 4. So it is known as case series. Okay. And you are sending it for journal. Next come case and control. Okay. For example, you have people who are smoking. Okay. And other who are not smoking. So you are taking how many of the smokers are getting cancer, how many of non-smoker are getting cancer. Okay. So this is a case control study. We are taking a history and then compare the history and draw the conclusion. Second is consider that these all are the case, means these all are having a cancer. So you are asking them, have you eating hot things in a plastic mug or not? And same question you are asking them. So you will see that cancer people are doing this, and you have asked for normal people, they are not doing this. So ultimately you are coming to the conclusion. So this is a case control. Then comes the cohort. Cohort is a group of people. As I said, you can either follow forward or you can follow backward. But when it's a group of people, you are following a smokers for a long time, following a non-smoker for a long time, and you compare, it is known as a cohort. Same way, if you take a cancer patient here, non-cancerous patient here, and you go back, it is known as a retrospective. The further is prospective, back is a retrospective. Okay. So in this case control, you have a condition, while in case cohort, you have some, we can say, stimulant. So this is the difference between both of them. Next comes the randomized control trial. So what is the meaning of randomized? You are randomly giving treatment to a people, but you are not knowing whom you will give and whom you will not give. So you have a group of people based on random number generator. So there are software available where it will generate the number. For example, sample sizes of 100. So who will get what, that random number will decide, and you will give treatment and control to them, follow up, and you compare the result. Okay. The next is double blinded study. Now the blind means what? Single blind study means your patient is not knowing it is in a new drug or old drug. Double blind means you are also not knowing that what you are giving is drug or what you are giving is new drug. And triple blind sometimes, that after doing a data, when the analysis is completed, then and then it is revealed that X was this and Y was this. Okay. So this is a double blind study. Then comes the meta-analysis, that we have a statistical analysis of different study, we combine it and then give one conclusion. Okay, 4 study, in 4 study it is like this, so it is this, but only statistical part. When only statistical part is taken into consideration, it is known as meta-analysis. When whole study is taken into consideration, it is known as systemic review, and it also include both published and unpublished studies. Okay, clear? So these are the different study design. What we have discussed till now in second part is different study design. Okay, so in meta-analysis, it was only statistical part. Here we are taking everything and then coming to the conclusion. So if these studies are wrong, systemic review will be wrong. Okay, so we have to be careful when we are putting our data. Clear? Any questions in this study design? Anyone? Any question to anyone in study design? Okay, so let's move forward. Develop a study protocol. Now, if you want to do the study, you have to do these things. Title, we have already discussed. You write the introduction and justification. Introduction means why. Whenever you are writing introduction, it is why. Then comes the methodology. Where you will do, on whom you will do, how you will do, for how many months. Then you will calculate the sample, that how many patients I want to study to give the conclusion. 1, 200, 200, 1000, 5000. Then you will prepare your tool or study questions. Okay. Then you will prepare a consent form, because it is important to take a consent of a patient before doing a study, that he is ready for the participation. Okay. Then data management. You will get the data and then you will analyze it. Based on that, you will have an expected outcome. Okay, this is the outcome. And lastly, Gantt chart. How many of you have heard about Gantt chart? Please put yes in the chat box. Have you heard about this word Gantt chart? You can put yes in the chat box.
Come in.
If
No, tomorrow is.
yeah, those who have heard, please put yes in the chat box.
Please mute yourself, doctor.
Okay. Actually, let me give an example of our routine life. That if you have a marriage on 31st of December, what you will do? You will plan. So you have to take one Excel file and you will decide that on 18th of February, I want to publish one case report in a conference. So those who are coming to Ahmedabad Medical Association conference. So for that, what you want? So on at least 14th of February, you should have a complete PPT. So on 4th of February, you should have a full detail of the case report. So before the 15 days, you will get the details of case. Before 10 days, you will finalize your study question or your protocol. Before that, you will do the literature search. So when we are doing a backward planning, it is known as the Gantt chart, and you are using any Excel or you can prepare on a piece of paper. So it will, and put it on your table. So you will realize that my deadlines are coming and I have to finish it. It is nothing but a tool to do a time management. Okay. Let's go to the next part. Once you do this, one important thing is inclusion and exclusion criteria. We will come to that. Okay. So if you are not aware of these things, you can enroll the statistician and finalize the type of study. Now here, there is something known as a bias. What is the bias? For example, I think that, okay, if the patient is coming to me and he is from this area, he will be having dengue only. It is not a malaria. So we are biased sometimes. And that's why these are the things which are used to reduce the bias. There is the blinding, crossover, randomization, and using a control group. Okay, I'm not going into the detail of each and everything because it will be beyond our today's session. And as we are starting with the basic, if required, we can have a detailed sessions after this one cohort is over. Okay, so develop an inclusion and exclusion criteria. To whom you will include in your study and to whom you will not include in your study. Okay. So these are like a exclusion and inclusion criteria that, okay, I have this characteristic, it is in, and if it is not, it is out. Okay, for your study. So then you have to calculate the sample size and you will finalize the, okay, these are the number of sample I need. Okay. Then you will develop the methodology based on different methods. We will not go into the detail of this. Then submission to ethics committee and CTRI. The full form of CTRI is Clinical Trial Registry of India. You can search in Google and you will find out that what are the study right now going on in India. Okay, Clinical Trial Registry of India. Next is ethical approval. So if you are doing any research, it needs ethical approval, and there are ethics committee, and there are separate ethics committee for academic study and separate ethics committee for new drugs. Okay, and if you are doing on animal, there is animal ethics committee. So you need to get an ethical approval. Okay, so see, if you are doing totally new drug, you need an approval from DCGI, then DGHS, a consent form, video recording of consent, compensation and gift. You have to describe and vulnerable population. So what is the difference between compensation versus gift? If we tell patient that you have to come 5 times a week to my clinic for this study, we need to give some compensation because he's coming from his house to our clinic, as well as he is losing his common day-to-day wages. So we have to do the compensation versus gift that I will pay you 2 lakhs rupees part of my research. So it is not done. Vulnerable population are the population who can't decide for themselves. For example, child. For example, prisoners. Okay. For example, a student, medical student appearing in exam. So they all are known as vulnerable populations. Okay. Then do the pilot study, do in the few patients, and then go for a detailed study. So you will come to know that is it properly working or not. Next is a data collection and data entry. If you are doing a study, try to keep in a hard copy, then fill in the performa, and then put it in the lock and key. Otherwise, it can be misused. There are lot stories are going on of such stalling of data. Okay. So try to do simultaneous data entry in Excel. So I'm just going briefly into the method because we are not going into the digital research right now. But you must know that what is presented to you is passed through all these things. So after that, you have to go for data analysis. So there are different softwares available like SPSS and simple or Excel. Okay. There are different tests, chi-square test based on the design we have to use. And then we have to prepare a report or a dissertation. And this is the long list, cover page, certificate, index, blah, 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 blah. So it includes everything. Okay. And last comes the dissemination. मेरे पास आ गया, फिर क्या? उस पे बैठ के मैं क्या करूंगा? So I will not sit on it and I will disseminate. How to disseminate? We can do the publication in newspaper, journals, peer-reviewed index journal, or we will present in the conference, either paper or poster. Okay. So this is the way we can do. We have completed all the 10 steps, starting from framing a research question up to the dissemination. What are the common errors? Vague research question, forgetting to get peer review of the protocol, forget to do the piloting, me to study. Means agar as the 10 people have done, I will also do me to study. Okay. Plagiarism. It is itself is a big topic. Copy paste is a plagiarism in a short word. Stealing of ideas, stealing of words from somebody, that is plagiarism. Cross-referencing. Tables and figures. Let me tell you. Try to analyze this table. Try to analyze this table. What this table says, can anybody tell? We will now not take more than 5 minutes. I know it's late, 10:30. Can anybody analyze this table?
Higher the temperature, the greater the growth.
Okay.
Bacteria.
And if I will mention in this line, how about it? What is better? Table or written line?
Written line.
Yes. So it is simple for understanding here. If I want to read this table, I have to stretch my head more. And this is a simple. So it is not necessary to put always table. Now just look at this table. It looks like the person has done so much of things and hi-fi study has been done. Okay. But I am simply converting the same table in this. So which is more easier to understand? See this. And now I am putting this. Second. So what is the difference? You look at here. Here it was in gram, milligram, and microgram, and converted into kilogram, microgram, and milligram. It has made it. So what MR are doing? They are displaying data like this. Okay. So again, let's look at the table. So this is one table and this is second table. So which is better? This one or this one? First or second?
Second.
Second. Okay. If I want to more clarity in this, we can remove this black background. So become more clear. Okay. Here what is happening in first? That the second data is hidden behind the first data? Okay, so you don't know. Clear? So these are the things you have to keep in mind when you look at the tables, when you are putting a diagram or anything. So to conclude, what we have completed today is what is research, how to choose the research topic, attributes of good research, steps in conducting research, and common error in a research or dissertation. Okay. So these are the people from where I have taken a guidance to prepare this presentation. Thank you very much. If you have any questions, we are open for question. I will stop sharing the PPT.
Thank you, sir. It's very interesting, and you took us step by step from the basics till the dissemination of the data too. So audience, if you have any questions, you can raise your hand and ask Dr. Chinmay directly, or you can put it on the chat box.
Chinmay bhai, there are lots of new words in your talk, and these words are to be understood well before we go for this research purpose.
Yes, sir.
Because there are so many new words.
So what I request that if you are in the group, just put the words which are difficult to understand. So we will try to again explain the WhatsApp group. And Sanjay sir, you asked one more question regarding how to find a mentor. So usually what is happening that for as an FFPAI as a group can start this scheme and involve some of the mentors from outside from the colleges, and then we can have a mentor-mentee scheme. Yes, important questions from Dr. Mohammed sir, that kindly give us a simple way in a general practice research. Yes, sir, we are going to target that only, because if you are going to do this, it is not possible, because we have seen that it is not feasible, because you have your private practice and you have lack of infrastructure which is required for the research. And important part is involvement of ethics committee. So what we are going to do is, we are starting with the case report. See, what is a case report? As I said, actually, we are going to discuss more detail in the next part, that what are the different type of publications, original research, okay, then brief report, then short communication, technical paper, that all we are going to discuss in next time. But let me clarify that we will focus on case report, how to write a case report. Because for case report, you doesn't require ethical committee permission. You require a consent from the person regarding whom you are writing. Okay, so for case report, you doesn't require ethics committee permission. Excellent question by Dr. Dinesh sir. Difference between qualitative and quantitative study. Excellent, sir. So whatever we have discussed till now is a quantitative study, because we are finding a quantity we can measure. But if I want to ask you that how do you feel today in this session? Can you quantify it? Yes or no? I am asking you a simple question right now, that how do you feel being in today's session? It is difficult. So what I will do, I will ask Sanjay sir, आपको कैसा लगा? How you feel today? So what you will do? Sir, can you answer?
As this is our first lecture on a research topic, so I think there are so many new things I come to know, but this requires another 2-3 lectures to understand properly.
Okay. And what is your feedback regarding session?
Well,
How,
if it is on Likert scale, then we can quantify, otherwise we cannot.
Yes, sir. Excellent, sir. Excellent. So what Sanjay sir has answered, that it was difficult to understand few of the words. It requires 2-3 questions more. 2-3 sessions more. And Sanjay sir, if I want to elaborate, I ask you for a few more questions. How was the presentation?
Presentation was excellent.
And now second question, means excellent means what?
Means you have covered most of the part as far as I know regarding the research. And I think there are so many new things for me to understand. So for me, it is 100% excellent.
Okay. So now what I have done with the Sanjay sir, it is very brief. Same thing I have to do with lot many people. If I want to go for qualitative study. So what I will do, whatever me and Sanjay sir has discussed, I will audio record. Then I will write everything. Okay. With the Sanjay sir. Then I will ask Preeti madam. Then I will start Bimal sir. Then I will ask Pandit sir. So I will note down till I get the same information again and again. Now everybody is saying the same thing, nothing new is coming. Then I will stop. Then I will do 2 more further study to know that, okay, again, same things are coming. Then I will write, then I will underline. So if we look at the discussion of me and Sanjay sir, there are 2 components. One was regarding feedback, one was regarding the difficult word. So similar words I will compile together and then I will present it. Okay, so that is a qualitative. But so based on that qualitative, I will prepare a quantitative study because I can't take interview of 1000 people. So as Bimal sir has rightly said, then I will prepare a Likert scale. That PPT was 1 to 5. Word understanding was 1 to 5. So then it becomes quantitative. Okay, so this is the difference between qualitative and quantitative research. Manju madam is saying that difficult, wondering whether I actually be able to do it. And that's why we are starting with the small thing. We will start with the baby step and then we'll go ahead.
Sir, this was absolutely excellent. But unfortunately, we do not remember the things what we have already given to us. Luckily, it's available on YouTube and we will be able to refer it back to that. But if you can get some notes, or maybe your presentation, that would be absolutely wonderful.
Sure. I will be sharing my PPT with all of you.
Thank you, sir.
Sir, Dr. Bimal, the YouTube, the live recording of this will be available to you at any point of time. This has been recorded and on the FFPAI YouTube channel, it is available.
Okay, that's fine.
Yeah.
Okay. So any questions?
I think everybody's too hungry or too tired.
Yes. I think everybody's hungry. Yes, thank you, sir.
Yeah, thank you. So, let's conclude.
Yeah, thank you very much, everyone. And we are there in the WhatsApp group. So those who are not in the WhatsApp group can approach the organizing people. So they can add you. And I think sir has already mailed everybody a link to join the WhatsApp group. So be there and have a happy meal and good night.
A small announcement, please, those who are not a part of the WhatsApp group, those who have registered will get an email ID, email from the FFPAI official mail. And please join the WhatsApp group so that you can with Dr. Chinmay and any one of us. Thank you. Over to Dr. Sanjay Shah for the vote of thanks.
Thank you very much, Dr. Chinmay Bhai. You have covered this topic very well, and we are very glad to listen you. I think we have to listen you again on YouTube, and we have to understand so many new words mentioned by you. But I think this is a new startup, and I hope if we go continuously with this, we can go in the research field. Thank you, sir. And thank you all those who have participated in this program. And thank you all.
Thank you. Bye-bye.
Thank you. Thank you very much, sir.
Thank you.
Rushil, you can end the